She is a senior health writer for NBC News, and today she is a former managing editor for healthcare and technology at National Journal. She's worked as a science editor for Reuters. She has reported from a stunning array of countries and continents around the world. She's won awards from the Society of Business Editors and Writers, the National Immunization Program, the Overseas Press Club, and other organizations. She is quite experienced and competent, and we appreciate her being here. So Maggie is going to talk to us a little bit about numbers around these outbreaks, where we can find them, and sort of how to tackle the reporting on these issues. So Maggie, thanks so much.
Thanks. Thanks a lot. And really, you don't have to listen. You can. Does this? When the mic's here, do you hear me all right, or do I need to bring it closer to my? No, it's okay. I can just.
Mic is actually.
That's okay. I can bring it forward. Is that better? It's not?
There, now.
Oh, okay. There we go. So it sounds to me like a lot of you are experienced. Before I kind of dive into the ABC 1, 2, 3 on numbers, how many of you have been reporting on measles anyway and are familiar with where to get the data and the statistics? A few, but not everybody. Okay, so we'll go through it. I just wanted to give you a look first at how we're covering the story at NBC News. We've created a measles outbreak page so that we can keep all the stories in one place so that people can go and find them as new stories come up. In fact, I did a little one just now with when Dr. Schuckett told us the new numbers. Probably like everybody else, we jump all over the new numbers. It's just been published. Because numbers, as you know, give you a great opportunity to update your story. That's not a good sign, is it? So we got above 150 today with 154, she said, 133 linked to the Disney outbreak, which is, of course, what everybody cares about. One thing she kind of touched on is that CDC's numbers aren't necessarily real time. It's something I've had a really hard time explaining to my colleagues at NBC. They're all about, let's get these numbers precise. Is it 153? Is it 154? Does that count the new case in Georgia? And what's really hard to explain to anybody, let alone an editor, is that these numbers are not reported in real time. As Dr. Schuckett pointed out, there isn't some central computer system where the state epidemiologist just taps the number in and it automatically updates the CDC number. These things are still reported manually, and it can take weeks sometimes for these numbers to be updated. That said, CDC offers some one-stop shopping here. You can just go to cdc.gov and search from there. Does everyone know about their A to Z index? If you look over in the upper corner there, you can search any disease, not just measles, by the A to Z index. It's unbelievably handy. And they've done a great job. They've hired a bunch of outside contractors there actually to put these numbers into their system and put them on the web page. It's pretty cool. But you can just link on this measles what you need to know page. They've got so much data. They've got infographics. They've got stuff written out in language that you can use for the average person, for patients and caregivers. But what you really want to look for if you want the latest numbers, over here, can you see this cursor moving? Do you see stats and surveillance over there? That's what you want to look for on the CDC page when you want their latest numbers. Their stats and surveillance. And again, there's so very much information right now that you may have to noodle around a little bit to find their latest numbers there. I'm not going to take you to every single page. I would just say remember CDC and remember stats and surveillance. But you can find data on how many people are covered and where, how many people have been vaccinated and where. They will also help direct you to the state websites. The other one-stop shopping is the World Health Organization's website. And if you just remember WHO.int, INT for international, they have all sorts of data and statistics too. I went to their measles page there. But there are really good stories to be had in comparing U.S. measles rates to other countries. And I think your question kind of tapped on that. Number one, there are legislators, there are members of Congress, there are certain cable networks that are saying that immigrants are bringing measles to the U.S. As Dr. Schuckett pointed out, the data don't support that. It's in fact U.S. travelers. But there's a great story to be had in saying, okay, where is measles and what are the vaccination rates? If you go to the WHO website, you'll see that most of Latin America is far more thoroughly vaccinated than the U.S. is. They've got up to 99% vaccination coverage. That made a good story for us when a certain legislator said that remember there was a rush of kids coming in over the Texas border unescorted? There was a legislator who said they were bringing in Ebola, which was a bit ridiculous. But he also said they were bringing in measles. And we could go right to the WHO site or the PAHO site if you want to just look at Latin America and look at the measles vaccination rates. In fact, let's look it up for various countries. You can just Google it. And you can see that, in fact, these kids are less likely to be, this is on the World Bank site, these kids are less likely to be bringing measles in than they are to be getting measles once they're already here. This site here that the World Bank maintains gives you the vaccination rates for all the countries. So you can look it up. We got a fun story. We decided to look at measles rates in Europe. And we found out, well, I mean, we kind of knew, but we found out that France was still having a pretty bad outbreak. Germany's a mess. There's a lot of cases in Germany, Italy. Probably the best known case is Britain, where they had the MMR vaccine scares far before we did in the United States. And their vaccination rates plummeted into the 80s, 80%, 84%, 85%. And they had some really bad outbreaks of measles. So we followed up with the ECDC, the European Center for Disease Prevention and Control, which is their equivalent of the CDC. They also have very good surveillance data, statistics, fact sheets and information. So we did a story just comparing the U.S. to Europe. Let's see if I can find that one quickly. Well, I'm not going to make you watch me do that. Anyway, basically the Europeans were saying, we're envious of your measles rates. We've been fighting it. One thing that I think is important to do, though, is you do need somebody to interpret that data for you. There were many people who were asking us whether it was forced vaccination in the U.S. that was making the difference between the rates that we were having and the rates in Europe. And the answer was no. It wasn't, because there are some European countries that have compulsory vaccination that's strongly enforced that nonetheless still had high numbers of measles cases as well. So I was able to talk to somebody at the ECDC who said, no, in fact, we have the same problems you have. In France, there are pockets of philosophical non-vaccinators, people who feel like natural is better. They doubt the safety of the vaccines. In other countries, it was just a lack of access. In Italy, they don't vaccinate in the pediatrician's offices. And so they have the same situation there as we had in the United States in the 90s, which was kids whose parents actually would have gotten them vaccinated if they'd had access to the vaccines. So just looking at the numbers can get you started on a story. But I urge everybody to please not use the numbers alone as the basis of a story, and don't speculate. All these organizations have really helpful people who will interpret the numbers for you. In health, like in no other subject area, the interpretation of the numbers is key. One reason for that is because the numbers are so incomplete sometimes, and especially here in the States, and they come in so slowly. State epidemiologists are a really good place to start with. The California Department of Public Health, right now, of course, because of the Disneyland outbreak, they've been keeping data and statistics on their website, and their state epidemiologist is also very helpful and very knowledgeable, and they've been holding regular updates. If you go to their page or any of the state's pages actually, they will have a website where you can sign up to be on their email lists, and they'll email you when they update the data, which is also useful. The state data is often not up to date. It's often more up to date than the CDC data. They have pages with media resources for you too. They'll answer your questions. But sometimes it's tedious, but when there's a big national outbreak and we're trying to get the latest numbers, we just manually go to each of the 50 state websites and look and see what data they've posted. Most of them have a direct line also to the state epidemiologist. It's meant to be for doctors to report outbreaks, but reporters can use those numbers. I've used them with great success. You get straight through the epidemiologist and they'll tell you exactly what's going on. I used it last Friday when the CDC announced there was this new virus that had killed somebody in Kansas, and called the state epidemiologist. They told me all about it. They're really happy, actually, to talk to you about those numbers. So having those two tools, their state website, they'll have updated the numbers, and then being able to speak to somebody on their epidemiology team. Most of them are CDC trained. Most of them are very familiar with talking to the media, and they can be unbelievably helpful with that. I don't know how much you all need to know or want to know. I was going to leave a lot of time for actually just discussion or Q&A about how to use the numbers or where the numbers come from. Is there anything in particular that people are interested in hearing about on coverage? When you're done chewing.
I like to kind of find, real people who are dealing with this and talking about this. I'm wondering if there are any discussion boards that you would recommend. For example, if I try to find out more about people who are having measles parties, how do I track those people down other than using Twitter?
That's one of the biggest challenges.
Yeah.
The measles parties is mostly an urban myth, right? That's it's one of those.
I saw that, yeah. But I think chickenpox parties do happen.
They do. In fact, my
Okay.
sister sent her sons to one.
Oh. Okay.
On her pediatrician's advice. You can imagine.
Really?
Yeah, I went absolutely nuts over that.
Okay. That would be a good story.
In VIC, the National Vaccine Information Center, these are the main people who are fueling the vaccine doubting population. However, they're unbelievably helpful at getting you people who will tell you their stories, why they're not interested in vaccines, why they doubt. And for a while, this organization and Barbara Lowe Fisher, who's their leader, were kind of pariahs. But the public health community realized that it didn't do very much good to ostracize people, to call them stupid, to call them wrong. It's not terribly useful way of communicating. It just hardens people's attitudes. So they've begun to be invited to meetings of like the Advisory Committee on Immunization Practices, which holds regular meetings and advises the CDC. They're invited to FDA hearings on new vaccines or on new uses for vaccines, and they're allowed to provide input from the kind of vaccine worry community. So that's a great resource there. I think you can probably find some of the chat rooms too. There's groups like DC Urban Moms,
Okay.
listservs. There are various mothers groups on Facebook. They're very vocal about posting their opinions, and a lot of people will talk to you. We've had trouble getting people to go on camera though, because they say they get an unbelievably rough pushback from their community.
Right.
We've got lots of people who will talk even for print, but they don't want their picture used and they don't want to go on camera.
Thank you.
Any other queries or comments? This isn't being webcast, right? We're just in the room.
Correct.
Okay. Would it be useful to go through the websites a little bit and look what's there? Or do you want to dig down into where the good data can be found? The CDC site can be really a bit daunting. There's so much information there, and you have to look around hard. They've got a quick place you can go to called Measles Fast Stats, which is really useful. A lot of their stuff is in PDF form, which makes it a bit clumsy. Another useful website is the NIAID, which is one of the National Institutes of Health. You always have to remember to put the .nih.gov after one of those institutions. But they've got updated information too on measles vaccines. We've got a very slow connection here. They also have data and information on other stories as well. If they're covering other infectious diseases, they've got a great page on Ebola vaccines and Ebola treatments, where they talk about who makes them, what's in them, how they're made, how they're being deployed. Oh, that's not good. That's all right. Let's try this. I think, just showing how the searches go is probably useful too. Sometimes the best way to search is this way. And what you want to look for is NIAID's page. And I guess everybody knows not to just Google stuff and bring up the first website. It's not necessarily useful. No, that's not going to bring it up. That might take a while to get to. Emory University has a great site. The director of their vaccine center is Walt Orenstein. They have a very useful website that tells you about how the vaccine is made. And he can answer lots of questions as well. If you look at Emory's website or Dr. Orenstein's lab website. The universities are often a really good source of information as well. They've got probably more data on research, but great sources there also. I'm going to just put this CDC page back up so people can copy down the URL if they need to. But again, I urge people to use the A to Z index. I'm constantly sending our own producers there.
And just so everybody knows, we'll capture all these websites from the history and post them, afterward on the website, so you'll have access to them if you're not taking notes.
But what's good is that, so you don't have to write down a long URL. Just, write down cdc.gov, who.int, nbcnews.com.
Maggie, when you guys post the latest CDC numbers, you were talking about adding context to them. Sometimes I'll write up like a small thing about, then the new numbers come out every Monday, and here's the latest count. But how do we add value to that? Or like, what do you do in your post other than saying we have 154 cases now? And like, what does that mean to people?
Right. We have this format called a capsule format where you can only write 150 words. We're finding that's all people will read on the mobile devices. So what we do is, farther down, we link to some of our longer, bigger stories that have more information in them, so that people can link on the longer stories. And doing things like, what we call a storyline. Oh God, that's going to bring up a video. I don't want to do that. The measles storyline, so that when they click on the story, they can click back to the storyline and see all the stories we've done. Because you can't put all the context in. I try to write some of the context in as much as I can. Dr. Schuckett made it really easy for us this morning, being here, so we could talk about the vaccination rates. Schuckett says the virus is almost certainly imported. Get that point across. We put in a line about the fact that measles can indeed be deadly. We use our social media feedback to answer a lot of these questions, to know which context is the most important, and we kind of look at what questions people are asking, what comments they're making on Facebook, and we get a lot of comments about people saying measles doesn't kill you. So we try to put that context in as much as we can, and we mention the immigration stuff a lot because that is something also that people talk about.
Can you talk about that? This may have been published, but I haven't seen numbers from some of the communities that have been vaccine hesitant, where they have low numbers of vaccinations. Now that we're seeing all these cases of measles, are they starting to vaccinate there? Are the numbers coming up in those communities, and how will we find out?
That's data I'd like to get hold of too. This is one of the most challenging things about reporting on health and data and statistics, because the numbers don't come in real time. And the researchers, the epidemiologists, the doctors, the CDC, they're very used to this very careful, prolonged process of publishing what they know. The CDC's gotten a little bit better about rushing stuff into what's called the MMWR, the Morbidity and Mortality Weekly Report. But it's hard for them to get their heads around the idea that this data needs to come out fast, mostly because they like to check and double check and go back through the numbers, have somebody else look at their numbers and poke holes in it. It can sometimes be months later before you find out that the vaccination rates actually did go up. They are aware of the frustration. I think they're aware of how this affects not just how the media report the story, but how policymakers approach it as well. It's unbelievably frustrating to get this, and you usually do have to wait until somebody has published it somewhere. We rely on anecdotal evidence, which isn't always that great, but we found, for instance, Jenny McCarthy's pediatrician, and we called him up and interviewed him, and he said, yeah, actually, patients are coming to me and asking to be vaccinated. And that's when he kind of made his switch and said, I'm not actually anti-vaccine, which was interesting that he's recanted that. So that's a hard one to get right.
If I could comment on that, there was a paper published in Pediatrics in Washington State, so Washington has had a lot of pertussis, and they asked the question that you're asking, which is, did it result in more children getting vaccinated? And in the study they did, they didn't find that to be the case. But that's really hard to study, and it's they acknowledge, and there are a lot of limitations to that study. So the thinking was, as you suggested, and it didn't bear out in Washington State, but I would be careful to hang my hat on that study. I mean, it was done well, given motivation. It's just a very hard study.
Because you have to do these big national surveys, right? Like in Haynes, and it takes forever to crunch that data. When they do these deep in-person interviews with people to actually ask, was your kid vaccinated, right?
Well, I remember what they did is they looked at the immunization registry data in Washington State. I mean, your point is right that the paper came out in Pediatrics maybe 4 months ago, but they probably started the study 2 years before that, right? This is the nature of science. And they used immunization registry data, and they looked at preschool children, and they didn't find an increase in the vaccination rates of preschool children in the registry that was associated with the resurgence of pertussis. And I can get into methodological reasons, but that's really hard to study that way. So, the question is a great one. I think time will tell, and there'll be other studies that will answer it better.
I think once there's more coordination of electronic medical records, a lot of this data will become more quickly available. I think everybody's worried about HIPAA, somehow releasing somebody's private information inadvertently. I think once those things are taken care of, then it'll be easier. But for instance, I think you asked a question about not being a parent and how do your immunization records go in? I have to manually copy my daughter's shot records every time I register for a new camp or a new school. I mean, that stuff is not available electronically. And you'll notice when the CDC data comes out on how many people are vaccinated, there will be like 20% don't know their vaccination status because there's no record. It's nuts. Probably in 10 years this will all be completely different, but it's probably going to take that long to get the different software programs to talk to each other and to get the framework of legislation that you need around the technology that's involved in place.
Question, I've been having this problem. Like, your story there, it says 133 cases are linked to the Disneyland outbreak. And then I go to the CDC website, and it tells me 118 are part of the ongoing outbreak. And I'm so confused which one is the right number. You were talking about this. Like, Dr. Shuchet today said a total of 154. Everyone agrees on that. But then where did you guys get that 133 number?
She said it just now standing in front of us. They may not have updated the website yet.
Okay,
Which
but
can
the
be
130. Okay, so it
Yeah,
just might not
that
be
was
on the website.
that was from her.
Okay.
The 118 I think was last week's number from CDC.
Mhm.
That I mean they're quite dilatory in updating their websites.
Yeah.
Which can also be frustrating, and sometimes your website caches too. You don't realize that it's been updated because you've cached it. Like I say, I really try to steer people away from breaking numbers on any disease outbreak because it is such a red herring. And Dr. Schuckett kind of, mentioned this, that the numbers come and go too because you get a report and then you have to confirm it. It's this frustrating with Ebola too. Everyone keeps asking me, how can Ebola have a 70% death rate when there's 23,000 cases and 9,000 deaths? And how do you reconcile that? And it's because WHO doesn't get a record of everyone who dies from Ebola. They don't know. They've got 9,000 confirmed deaths. Many more people have certainly died of Ebola, but it's not recorded anywhere. And none of these health authorities are going to give you a number unless it's recorded somewhere, unless there's a death certificate linked with it. And that actually explains a lot of why this data is so slow and so hard to get up to date.
Where do you go when you're looking for emerging diseases, the next Ebola, the next measles? I guess the closest thing I can think of now that's a possibility is the Middle East respiratory virus.
Mm-hmm.
But where do you kind of go when you're trying to get ahead of what could happen?
I don't think data provides that answer. I think you have to talk to people. I think you have to talk to the experts in these viruses over the years. That's why I always urge people to talk to someone to get them to interpret the numbers for you, because that's also your next source for the next story. I've been covering bioterrorism for a lot of years, and there's a whole field of expertise there where they are looking for the next emerging threat. Now that said, the NIH has a page where they talk about what the emerging threats are. CDC does too. And I think it's under biothreats. Let me just look and see. But they have a list of the diseases. Laura, do you know? Is it biohazards?
I'm not sure.
Bioterrorism agents and diseases. These are things that are known to be possible biological weapons. They're things that there are groups keeping an eye on. There's also a fantastic listserv called ProMed, which was set up for the for the infectious diseases community that people use, and basically their emails go out every day on various infectious diseases. Unfortunately, it can get a bit dense because they talk about animal diseases as well. But people will update what's going on with MERS every single day on there. They're watching the various bird flus. There's H7N9, there's H5N1, there's the occasional outbreak of an H10 flu, and people will post those reports so that you can kind of keep an eye on what the emerging infectious diseases are. CDC has a whole journal devoted to emerging infectious diseases.
And that's, I was wondering if there was a way to even get ahead of that. That was the last one that I wrote about, and I wrote about it kind of in conjunction with the King of Saudi Arabia passing away, and a lot of people kind of being in the same spot. And obviously I want to try to watch out for those things. But I think you're right. Just talking to people is going to be.
Yeah, shoe leather reporting is never going to go out of style.
Yeah.
Crunching data is useful and interesting and a great place to get story ideas, but you really also just need to talk to people. It's amazing what you will find out just talking to people.
It's incredibly hard to predict that. When you talk to the experts, there were people with Ebola who were saying 10 years ago, we really got to fund vaccine research, and it was more, and they were candidate vaccines a decade ago. And obviously they weren't compelling enough in their arguments because we don't have a vaccine today, right? And flu is so hard to predict. I mean, look at 76, and if you want to bet on flu against the people thinking, you'll probably be right, because it's so hard to predict.
And then I feel like it's also hard because something might be emerging, but the public health community might deal with it. And then,
You don't know
that's
what's
not-
been prevented, do you?
Right, we don't
There's-
know what's been prevented.
Right.
I think it's
Yeah, exactly. It's true. I think everybody, the first thing they'll tell you, any expert, is you can't predict it. And if you try to, you're a fool. Don't listen to anybody who says that they can.
I think that's a really compelling argument for why we need to fund these issues more, because they are potentially a global threat, and they're really, really hard to predict. If we could predict which emerging infectious diseases are going to cause the next problem, then we can focus
We
the
would know what to
funding
do.
there, right? But we don't, so.
Exactly. There's another whole, there's a whole organization, a website devoted to infectious diseases. It's CIDRAP. It's Mike Osterholm's group at the University of Minnesota. He set up an entire institute. They send out daily emails. You can sign up for their emails, and they cover this stuff like a duck on a June bug. They are all over any kind of infectious disease story. If it's something you're interested in, they're on it. They're on the data, and they're very good. They're all specialized journalists, and they're working under the supervision of the epidemiologists at the University of Minnesota. I highly recommend the site. It's a great tip sheet as well, and they cover the entire range of emerging infectious diseases, and they're all over the measles story as well. It's a great source for you. And if you want to know about MERS, they're all over that. And there's Twitter feeds, of course, devoted to each of these diseases. I have a whole column for nothing but H7N9 bird flu, and another one for MERS to see what's out there. There are some fabulous bloggers. They started with the flu. I think it got really fashionable when bird flu was first an emerging threat, and this community of bloggers kind of sprang up. A lot of them are themselves infectious disease experts, or they might be amateur infectious disease experts, but they follow it instantly. I wouldn't use them as a direct source, but there's certainly a great tip sheet. They
Right.
certainly aggregate all the good reporting that's out there, and they're so interested in the subject matter that they can gather a lot of information. They often post direct links to the resource as well, which is useful, so you can go back to the primary source and look and see, did that paper actually say that? It's,
Do you have an example of a blogger that you go to?
there's one called Flu Trackers.
Okay.
And they've got a whole forum here. They're not so interested in measles, but sometimes they do kind of glom onto whatever the latest emerging disease is, but their real interest is flu, because as any epidemiologist will tell you, that the odds of another flu pandemic are 100%. There will be one. It's only a question of when. H1N1 was one. It wasn't as bad as people thought, but it was technically a pandemic, and that can happen with something worse. And so these guys are really watching out for it, and they're very alert to these issues. Has anyone come up with any problems in their reporting, like getting good data, or does anyone have any hints to share of a good resource that you found?
Well, my problem is that I report in Spanish, so I do most of my research in English. And to actually link to pages where the same information that's provided in English is provided in Spanish is kind of hard. I don't know if you can suggest,
Like
some
PAHO,
pages.
PAHO site?
Well, PAHO, the basic ones, PAHO, the World Health Organization, and, the typical ones is fine. But like, for instance, the CDC sometimes has incongruencies, it's just not the same thing, or it's, presented differently. So it's kind of hard to sort of get good information. I do try with some of the Spaniards websites, which sometimes from the different medical schools have offered, but if you have any tips on that, that would be great.
Actually, I'd take your tips. My daughter goes to a bilingual school. She learns in Spanish, and they had an infectious disease section, and she's like, "Mom, I was just like typing your stories into Google Translate." There is a dearth of Spanish language resources, believe it or not, which is difficult. I've got a whole bunch of books back ordered for the school right now.
Oh my goodness.
They go out of print. Yeah, it's
Yeah.
it's a big problem.
It is a big problem. Well, the CDC's tried very hard, and I think they have revamped what they have, but it's still a lot of the pages in Spanish is not up to date to the English ones. So
Yeah, because they don't have, well, they had to fire all their contractors when the federal government closed, and it's taking them a while to hire them back. I mean, you know, once you know the backstory behind all these things, you think it's a miracle we get any information at all.
okay.
It's really tough, and the funding just isn't there for anything. You know, when we were discussing just a minute ago why there was no funding for Ebola vaccines, right? It's because there was no market. And it's amazing how short the attention span of Congress is. It was like for a while, you couldn't find, you know, there was more money than need for funding bioterrorism research, and it lasted about 2 years, and then it was gone. And all the Ebola money went with that, and a lot of the other research kind of just fell behind.
How much of a concern would you say bioterrorism is? I mean, I have to admit, every day that I'm out in DC, I think, you know, how easy it would be to, in the metro, to have a biochemical weapon. You know, not that I'm afraid every day, but it is something, you know, that crosses my mind. I have a sister who was in Afghanistan and everything, and is it, you're saying it's not something that Congress considers a national priority, but maybe they should?
I'm not saying maybe they should. I'm saying they used to consider it a priority, and now they don't. I don't know if you remember, there used to be detectors in the metro stations. You used to see those little aluminum detectors, and there was one out on the National Mall, and it actually detected tularemia, just like in the air, and because it does exist in the soil. And now I think it's like anything else. If something bad doesn't happen, that interest dies down. It reached a peak right after September 11th. Most people were predicting a bioterrorism attack, and then of course the one that came was homegrown. Probably a scientist trying to prove the point that there was a risk and that we needed to pay attention to it. But I think the longer we go without one.
Do they still have those detectors?
I was just wondering, I can't remember having seen one. Has anybody seen one lately? You know what they look like? They're like usually usually put them under the escalator. They're like under the backside of the escalator, and it's like this little aluminum contraption. It's smaller than the size of this table. It doesn't look like anything at all, but evidently they're highly sensitive.
I see such things in Farragut West all the time.
Do they still have them
I
there?
didn't know that's what they were, and maybe they aren't. Maybe they're something else. But they stand about that high, and they look like they're not. They don't show by their shape what they are.
Right. It's
They're
not
shiny
substantial
aluminum.
looking. It's like a rack almost. It looks,
Yeah.
it's kind of a rack-like structure.
Looks like a lab experiment that somebody left in the subway.
Yeah.
Do they put them in a lot of city transportation?
For a while, they were everywhere.
Okay.
For a while, you just couldn't go anywhere without seeing one, and I've seen them less and less. And I have to admit, I haven't ridden Metro very much lately, so I live on the Red Line. That's it.
Yeah.
Well, I missed that, and now I'm fascinated. Can somebody fill me in? What were you talking about? What thing in the metro?
They're biological agent detectors.
Oh, wow, that's so cool.
Yeah, looking for
That's
anthrax.
story.
You know.
DC.
Well, I mean, anthrax, it turns out, was a real threat. It did get released. I mean, how many of you stopped getting mail for 5 years, right? We stopped all inter-office mail. It was great.
Contributed to the outrageous growth of email.
Yes. But at least that's easy to get rid of.
The 118 versus 133, the 133 includes cases in December. That's another tricky issue with CDC stuff, because half their numbers are January to present, but the outbreak started in December.
Right.
So, okay, good to know. Thank you very much.